During pregnancy, it is important to look at your medical reports, speak to your doctor. Different women go through different changes in their body. I would definitely like to mention the myths that if I penetrate, I'll be poking the child or I'll be hurting the child.
That's ridiculous.
That is, but when she's aroused, just like a penis, the vagina also expands and makes space for the penis. You won't be hurting the child. Men think foreplay means straight away going and grabbing the woman, not penetrating, but playing with the breast or the clitoris or just touching her everywhere and getting aggressive with the body. The woman actually wants a little bit of flirting, a little bit of pampering, a little bit of sweet talking. There's a build-up. So continue doing that to begin with.
I think everything is so goal-oriented. I have to come, I have to ejaculate, I have to orgasm.
This is one thing women don't like.
Yeah.
To orgasm each time. There's pressure to perform and then there's pressure to come.
Yeah.
Did you come? Did you come? Did you come?
Yeah.
Like, what?
Hi, I'm Karishma Chavan and welcome back to another episode of Sass It Up with Sassiest. Today again we have Niyatii and Shah, who is an enthusiastic, passionate and renowned sexuality educator, councilor, author and an intimacy coach who believes in educating children and adults on sex education so they get to know themselves. She is a mother of 2 children, wife of a very supportive husband and a daughter of liberal and very loving parents. She's a sexuality educator, councilor and author of 2 books and a TEDx speaker. She is certified in sex education, the Robert Kharkiv model of personal counseling, metaphor therapy, graphology, basic transactional analysis, and NLP practitioner. Welcome back, Niyatii.
Thank you back once again. So lovely to be here one more time.
Yes, and as I said, our conversations are going to be endless. So this is hopefully only the second one of this particular season, but many more to come. Today is yet another very interesting topic, and I don't think people discuss this enough. Especially when it comes to couples and how they have to deal with their, family planning, pregnancy, and most importantly, intimacy during pregnancy and post-pregnancy. So these are very, very sensitive topics that I think all couples or new parents should have information of and also have the right guidance. And they should be, approaching people like you and taking their tips and tricks to have a great intimate life while they are, baby making.
It's a fabulous topic and I'm so happy that you're covering it.
Yeah.
While our parents and our mothers are teaching us how to take care of our physical self during pregnancy and after, nobody's talking about the intimacy.
Absolutely,
And
which
I'm
is
glad
so
you are.
important. I think women are so much more vulnerable and emotional in that phase of their lives. It's so brand new,
Yes.
when you are getting pregnant and you're having your first baby, and there's so much of nervousness and there's so much of anxiety, and then to have a partner who is understanding of those moments and is going to be there for you physically and emotionally, because I think emotional intimacy at that moment of time is absolutely important, but also the physical aspect of it, to nurture you, to cuddle you, to hold you in times of your lows and your highs, because you're going through various hormonal changes which is going to be fluctuating your moods and creating all that havoc. But I want you to tell me more about, should couples go to a counselor to understand what they can do better for each other during pregnancy?
So particularly during pregnancy, it is important to look at your medical reports, speak to your doctor, definitely, because different women go through different changes in their body. Sometimes the pregnancy is not as simple. Sometimes you need a little more care. Sometimes you need different postures, positions. Sometimes it's something else. Sometimes it's not. There are a lot of complications. So depending on how your pregnancy, how the person's pregnancy is going, the doctor will advise accordingly. But would definitely like to mention the myths that if I penetrate, I'll be poking the child or I'll be hurting the child.
That's ridiculous.
That is, but if you actually think from a logical point of view, I can understand why people believe so. But this is because we don't know our own anatomy.
Correct.
So if the men knew that even though the vagina is 1.5 inch normally, when she's aroused, just like a penis, the vagina also expands and makes space for the penis. So you won't be hurting the child. And go gently. You don't have to go
ramming in it, having at it completely and going all berserk. Yes, of course.
So be nice, be gentle, have the fun, keep certain things in mind, but still, I mean, it should not completely disappear out of your life. You don't have to take care of your wife in a way where you feel that she won't need it or I'll be hurting her. Somewhere in her heart, she's probably begging for it. And communication is a big problem in our,
society, Indian society, yes.
So maybe she won't tell you. But women do feel horny. They do want sex even when they're pregnant. And there are good ways to have different sexes. And every time it may not be an intercourse. But there are a lot of outer courses and a lot of ways to still have the physical intimacy that is very, very needed for the woman right now.
So I would think a lot of women would be very cautious. I think some women are of the thought process that probably don't touch me, they're too scared. Some women might think like that probably something would go wrong in the process of probably being intimate. Are there people who come with inhibitions in their head regarding intimacy, especially women?
So I have not had that experience where women are very scared. In fact, I've usually had the experience where the woman is like, how do I tell him it's okay?
Okay.
Because I think very intuitively, we know we are very strong. We can deal with this. There's no other problem. Somewhere we already know how much and how far can we take it. Men can have that because they don't know the anatomy.
True.
We may not know details, but we definitely, again, intuitively know that it's okay. And we are very strong that way.
Correct.
So emotionally also we are strong.
Yeah.
Physically also
we are strong.
We are very, very strong. So for me, my experience has been the other way around. Yes, there will be, and there are women who will be like, no, take care of me, and it's not wrong. It's how you feel and how you want to be taken care of. But there will be women who will feel fragile, who will feel like, I don't know if I'm doing the right thing. There will be doubts.
Correct.
But I think the best way for either of the scenario is to educate yourself.
Yes.
And you are going to the doctor every month.
Correct.
Take one more visit to understand what it is, how it is like, how much can we do it, what are the best positions.
Yes.
You can also call up your doctor to say sometimes this position is hurting or her back is hurting. So what else can we do? Don't just stop because, she's feeling the pain. There are so many different ways you can still be intimate.
Correct.
So explore more, ask more questions. But boldly, putting it in caps, I will say that do not let the physical intimacy go out of the window when the wife is pregnant.
Correct, absolutely.
For either.
For either, exactly.
For either.
For either, in the sense that I feel sometimes even, it's something that I've heard a lot, and I've had a couple of instances around me that I have seen, that men have chosen to stray during the pregnancy period. Now, obviously various factors could have been possible, but it's not uncommon to have heard something like this happen to people around you. Why is that? Why does that happen basically?
So multiple reasons again. There is a lot of societal bombardment of what a sexy figure looks like. So one is the body image, like, she's putting on weight, her stomach isn't coming in between, she's not sexy anymore, she doesn't wear those clothes anymore. So there is this one factor where the attraction kind of like goes down a little bit. And with pregnancy, it's not just the shape of the body, it's the color of your skin. There are it's the hair
falling.
There are so many different things that is happening to a woman at that time, and it may not be visually very pleasing to the husband.
It's not attractive. It's not sexy to look at.
It's not. So that is one of the reasons where they're like, she's not there anymore, and I need that, because that is stimulating for the men. The second also could be because the woman is saying no. She's so focused on her pregnancy, and somewhere this, the whole earlier experience of sex with the husband, now is the time to say, I can't do it. It's an excuse they find, you know, like I can't do
Possibly,
it.
correct,
I can't do it.
exactly.
I can't do it. So
Yeah.
that is one of the things I definitely know of, wherein they're like, this is my rest period where I will not be abused sometimes.
Yes,
I will
of course,
not be having bad sex. I mean, finally, you know, it's like I won't get periods
Take a break.
happiness.
Yes,
I
yes.
won't get sex
Yeah,
happiness. You know,
yeah.
that kind of a thing.
Yeah.
So that is another.
Wow.
And of course, the third is I am tired. My pregnancy is complicated. I can't have sex. And men do want to have sex.
Of
It is
course.
one of their,
Of
it is
course.
ours also, but they're very vocal about it and they want it, like, you know. So, few of the reasons why.
So, one thing I wanted to ask you was that you have intimacy, which is obviously physical, penetrative sex, that probably is a factor. What if that is not allowed for whatever reasons? What would be your, like your tips on how to keep it going during your pregnancy if you are told that, okay, penetration is something that you can't indulge in? So, what ways are you supposed to feel satisfied intimately, whether it be emotional or physical? What would be your take on what should be done?
So I'll begin from the foreplay point of view. Okay, most of the men think foreplay means straight away going and grabbing the woman, not penetrating, but playing with the breast or the clitoris, stimulating the clitoris, or just touching her everywhere and getting aggressive with the body. The woman actually wants a little bit of flirting,
Yes.
a little bit of pampering, a little bit of sweet talking. There's a build-up, which doesn't happen, right? So I would say penetration is like the last thing on the list.
Correct.
So foreplay still can happen.
Yeah.
You can still make her feel aroused. You can still feel aroused yourself with all these small little masti and, you know, small little gestures and stuff like that. So continue doing that to begin with. And when you're aroused, most of the women do not orgasm by penetration. They orgasm by stimulating and rubbing their clitoris. So you can still do that, still be gentle, still make her come. And if it is about you penetrating, again, there is a hand job, there's a blow job, there's oral sex, there's multiple outer, courses that you can do to satisfy. But now I am only covering the angle of where you want to ejaculate to feel satisfied.
Correct.
So there is another way to also feel satisfied and not ejaculate.
Yes.
So that's that too.
That, and I think a lot of people lose focus of that. I think everything is so goal oriented. I have to come, I have to ejaculate, I have to orgasm, that we forget to enjoy the process, of where we want to just be. It has to not necessarily go anywhere. It just has to merely exist with pleasure. And that, I think, we forget on most occasions. I think most people forget that. Everybody just like goal oriented. I want to come.
So I would never ask a couple not to have that goal because that's
of course,
deep peak.
of course.
But at the same time, it doesn't have to happen
every time. Yes.
So this is one thing women don't like.
Yeah.
To orgasm each time. Like there's pressure to perform and then there's pressure to come.
Yeah.
Did you come? Did you come? Did you come? Like, what?
I think when people don't see their partners come or ejaculate or orgasm, you tend to say, oh my God,
What
did I do something wrong?
Yes.
Am I not doing something correct? What can I do more?
Yes.
Why is it not happening for you?
Yes.
And then you start feeling inadequate in that process. Okay, I'm not satisfying that person to the extent that the person wants it. And maybe then that causes a little bit of a self-doubt.
The whole cycle starts.
Yes.
So it is very important to understand that sex is everything. From that smile and that eye contact till you have the orgasm.
Yes, absolutely. Everything in between is sex. I completely agree on that. So now when these lovely pregnant parents are now having their child and they have moved on to having their baby, what is the period that they are not supposed to have sex for? Like is there anything that post your, delivery, that you can't have sex for that period of time? Is there anything of that sort?
So usually women are asked to rest a little bit, the body is coming back. So the uterus was enlarged and it's coming back to its size. The whole baby had come out of the vagina. It won't take too much time, but yes, the body is healing from all this experience. So at least for 6 weeks. Somewhere there's this traditional concept of 40 days.
Yeah.
So these days just take rest. Physically, emotionally, mentally, just take rest. And I know for a fact in today's times, women are not doing that.
Yeah.
Different topic for another day.
Oh yeah, another
Different
topic altogether,
another
and
day.
we'll touch that for sure.
But they are not taking the rest,
Yeah.
and they want to go on.
Go back to their workouts and their jobs and everything within 20 days of having a baby in full power.
So those 40 days they have to take care of, and then with the advice of the doctor, when the doctor says, everything's fine, you can start, always ask this question.
Correct.
Now can we?
Correct.
Because we might feel everything's okay, I'm feeling okay, but there could be some angle. It's best to just take the advice and then begin.
Absolutely. And now that obviously when the women's bodies have changed so drastically, do women feel inadequate in their bodies post-pregnancy, or is that a factor? Like, do they have body image issues, when they are in that, or rather feeling that, more importantly?
I think as a society, we've told them.
Yeah.
We've told them. They initially never had any issue. So our issues are also based on what we are, what we are shown, what validations we get. So when the society say, okay, I understand if you've put on weight, but then get on, get back. Are you exercising? Are you doing this?
Yeah.
So women, to begin with, only the women are telling the women to come back to that size.
Yes.
Sometimes the husbands are very okay. Not that a heavy body or heavy weight is okay to have.
Yeah.
You must be healthy,
Yes.
but at the same time, you don't need the shaming.
Yeah.
You're not sexy.
Yeah.
That we don't
That
need.
we don't need.
need that, because
Yes.
in my head, I am so sexy.
Yeah.
And then everybody's telling me, but your husband will not like it, then he'll go out. And these are the talks between women.
Yes, absolutely.
Your husband will go away, then you can't blame him, unko to chahiye. All these things start happening. And then now it's become a norm, you have to lose the weight. You will lose if you do the right things. It's the same thing, lifestyle.
Your lifestyle, exactly. And give yourself enough time. In the sense ki don't be so harsh on yourself to get back to your, pre-baby bodies and, start saying, oh my God, she still looks so hot in spite of being a young mom or, few months old. All that. And that pressure is so evident. And I think more importantly, even people who are getting back to their bodies, they're also talking about it a lot more.
Yes.
I don't think anybody spoke about how their normalcy was attained post, coming out of a baby.
Yes.
Right now, there are a lot of people who are vocal about, oh, my baby did this to my body, but now it's coming back to normal, and having that period of time where I'm just a few kilos off my
Honestly.
there is a lot of conversation like that. And for me, I don't see that as to be that relevant, because you are taking care of yourself any which ways. And yes, kudos to you doing what you have out to achieve, what you're out to achieve when it comes to your personal goals. But I think it's more important to have a kinder conversation with yourself, where you're saying that, it's okay if I've taken a little longer than most people have taken to get back. And it's okay to be not so vocal about it and say, हाँ चलेगा, मैं कर रही हूँ, मेरे time पे कर रही हूँ. I don't think anybody should be pressurized to saying, get back.
With the outer pressure,
Yes.
Karishma, somewhere that person herself is also feeling the same.
Yes.
That's why it's affecting them.
Yes, exactly.
So if I love this story which goes around on social media, that if I tell you I don't like your blue hair, see, there's no reaction to it because you don't have blue hair. So when somebody says that you put on so much weight, you should not do this, it'll affect me only in my head. I know that this is a problem. But if I am aware, I'm educated, and I'm like, completely agree with you. Another 6 months and watch me.
And watch me,
You know, that confidence in yourself, the education, the awareness,
Yeah.
the confidence, the path
Yeah.
that, okay, I need to do this.
Correct.
Because at the end of the day, even I want a healthy body.
Sure. And you wanted to
Then
be
this
good-looking as
pressure
well.
will have no space.
Correct. I completely
But
agree.
when you yourself are in the like, haan yaar, I used to wear a M, I'm wearing an XL, those labels have,
Your self-talk is all what is messing with your mind.
yeah.
Yeah.
And then that becomes, and then you want to validate it.
Yeah.
So then as soon as somebody says that dress looked better on you, you're validating it. Because I've put on weight, no?
Correct.
You're saying this because like that,
Correct.
no? And
It-
remember
it
the conversation,
connects. It connects,
And
yes.
the conversation we just had outside,
Yeah.
like, that's why men have started lying to us.
Yeah.
No,
correct.
you look
Because
very
we have
beautiful.
been twisted regarding our thought process.
And we expect
Yeah.
them to say that to us.
Yes, I lied blatantly, or
Just
I'll
lie
be
to
like,
me.
you are lying to me. I know you're lying to me.
But then lie to me.
yeah, but lie to me.
but lie
Still
to
lie
me.
to me.
So
Yes.
all this kind of like,
Yeah.
you know, then where are you? What are you
Correct.
actually doing to
Correct.
yourself?
Correct. So now, okay, of course, the woman is definitely there, but when you have supportive husbands, I think men are a little more accepting. I think sometimes where they don't do men put the same amount of pressure on women as women do on themselves?
No, not at all. Not that I know of.
Yeah.
There are husbands and there are partners who do say, but I want you the way you were.
Correct.
There might be mentions that,
Yeah.
but you know, let's start working on it.
Correct.
There could be suggestions, there could be support, but then how it is seen is also important.
Yes.
And yes, there are men who are abusive. There are men who will say, "Ke itni moti ho gayi ho," like, you know, some abusive language,
Yeah.
some disrespectful language. So
Yeah.
we do have people.
Yes.
But on like a majority, they're also putting on weight somewhere. They don't have bellies or what?
They're
They
not
do.
Shah Rukh Khans. yeah.
So they are putting on weight.
Yeah.
They are also understanding it's a part and parcel. But yes, there is pressure for a woman to look in a certain way.
Yes.
Now again, as we were discussing earlier, this is more of an urban thing.
Yeah, that's
Then in our
very interesting.
towns and then
That's very
in our
interesting.
rural
Yeah.
places, they are like, ऐसे ही होता है.
Correct. They're far more accepting of their body types
They
or
just
body image.
know that
Yes,
happens.
correct.
So what is like? Of course, they were not educated medically and you know, from the health perspective.
Yeah.
So it was very easy for them to say, birth के बाद तो ऐसे ही होता है ना. Now we know that it doesn't need to stay there.
Correct.
We don't need to be like that.
Correct.
So we put pressure on others, but it's become uglier than it should have been.
Yeah.
It should remain in the tone of being supportive than being negative about it,
Yes.
than taunting people or making fun of them or making them feel any less. So that tonality has changed.
True. That definitely is the case. When we are talking about the baby basically come into your lives. Both of you all are obviously occupied. Most of the mother, because she is the primary caregiver in these kind of situations. I think intimacy also means that you have an equally helping hand from your partner. Taking care of the baby as much as possible, obviously, but also is very hands-on with the child. I think that does a lot to a woman's mental state, post her baby. Well, I know for a fact that my father used to be the ones. My father was one person who did not like me wearing Pampers. So the cloth ones. So the cloth ones means every time I peed in the pamper means it has to change. The cloth pamper had to change. But who's washing those Pampers? If the buy did not come, my father used to be washing that bucket full of Pampers. So these acts of hands-on, where you have a dad who is hands-on with your baby, I think that is another level of intimacy for a woman, where you see that kind of support. That's an emotional intimacy that you want from your partner. But having said that, does it become difficult for two people to get back their physical mojo post, a baby? Because the baby is taking so much of their mind space and they're exhausted. How are they supposed to come back and get that spark alive? And what are the techniques post a baby? What should they do post a baby?
So lot of things that you've mentioned here.
Yes.
Hands-on, a mother just needs hands.
Yeah. Oh.
She doesn't care who it is.
You.
Majorly like the mother, the maid, the mother-in-law, the sister-in-law, whoever.
Wouldn't it be valued more if your partner was also like a little more?
So now, yes, because now we are in that space where partner has to be, we have to be equal.
Correct.
Now that is the narrative. Earlier it didn't, like, why are you doing it? We are there, no. Like, this is our part of the job. There was a lot of clarity in what you should do and what we should do. And people would not interfere into each other's businesses.
Correct.
And I especially don't like it if my husband is going to come into the kitchen every day and ऐसे करते हैं ना, वैसे करते हैं ना. You do
your
your
department
stuff,
is
let
yours.
me do mine.
Yeah.
So I like it that way. Like we have very clear understandings of, I'll take all the suggestions.
Yeah.
Stand at the door and give me all the suggestions you can.
Yeah.
But this is my
Don't-
space. This is
correct.
my space. I do it. So that way now the whole point is we don't have those hands in the house.
Yes.
Nannies are expensive.
Correct.
Maids will only do as much as told to them.
Correct.
They will not extend a hand also. So who's left again?
Yes. Sir.
So
Yeah.
now you will have to be, right?
Yeah,
So
yeah.
as much as the men can be kept out of this because they are doing something else, not because of any other reason. But if they are coming home and giving that
Extra time.
I think it is more about being a family together.
Yes, yes.
It's not about you doing my work or you're helping me out.
Yeah.
It's just one more activity that you're doing as a family.
Yeah.
You know your wife has done so much. You're okay doing a little bit more in the house. You've done it. That is partnership.
Yes.
That's the partnership. But rather than the man understanding and giving that time and that action, it's now become you have to do it. So while you are pregnant, while the wife is pregnant, there's already discussions about tum kya karoge, hum kya karenge, how will we divide the time? I also want to go back to the job. So how are we? So the talk before the baby is born is, yes, you must prepare a little bit, no
Correct.
doubt about it.
Yeah.
But I think somewhere if it comes naturally, it is more valued. So
Absolutely,
how
of course.
important it is? It is important.
Yeah.
To give the mother that helping hand.
Yeah.
I have known fathers who have taken care of the babies.
Yes.
And mothers have gone to work like third month,
Yeah.
fourth month.
Yeah.
And
it's happened naturally. Correct.
so at the end what I would like to say is rather than comparing that unko dekho, inko dekho, understanding between the two.
Yeah.
I can do so much right now. Can you help me with the rest?
Correct.
Or I can see you doing so much right now. Can I just take some?
Yeah.
That intimacy is what.
Correct. So
will
there
be
was
valued.
this one very interesting, I don't remember where I saw it though. It said the couple cannot be 50-50 ever.
No, I don't believe in that.
And that is something that it stuck to me because you've been raised by a very strong woman and you're like, okay, yes, I have to be equal. And kudos to obviously the thought process that has come about. Ki yes, you are equal. But when you actually think of it in practicality, nothing can be 50-50. Sometimes there is a 70 and I'm a 70, you're a 30. Sometimes you're an 80, I'm a 20. But when I am a 20, I should have the ability to tell you, baby, I'm a 20 today. Can you
Yes.
hold fort of 80%?
Yes.
And I think that ability, or rather that because every day the dynamics changes,
Absolutely.
right? Today you're not that great, today I'm not that great. But to understand where we can step in and communicate that either strength or weakness on that particular day changes everything in a relationship. And that's when I wanted to talk about how the parenting partnership is. There are different dynamics also over there. But coming back, and that's another topic again, as I said, coming back to the sex point of it, where you start, post your 6 weeks of rest that you are advised by a doctor. Coming back to that, are there challenges?
Physical?
Yes, physical and mental, both. Are there challenges?
Absolutely. So mental, we are very, very aware, and It's not a secret anymore of postpartum depression.
Yes.
So that is something so true. And I have been I won't call myself a victim or a patient, but I've gone through it. I've experienced it. And I know for a fact that even to recognize that you have that is a challenge. You come to know later.
Can you
That is what it was.
Just for the audience, can you just delve a little bit into what postpartum depression is and what it symptomatically is?
So I remember when I delivered my first baby, and everything that was happening in my life was wrong.
Oh.
You said to me, you told me this, you did this to me, I am not okay, but I want to do this, but I'm not able to do this. I would love it this way, but I'm not doing it that way. At the same time, I'm equally happy with my child.
Correct.
I love being with him. I am being creative with him. I'm being the best version of me. I'm laughing, I'm giggling, I'm playing. So you don't recognize the other side of what's happening to you. As soon as the baby is out of sight,
Yeah.
and I'm like down completely. For me, it was not understanding what was going on, not knowing also at that point in time that this is called a postpartum depression.
Correct.
So there was a lot of, I don't know where I am.
Yeah. Okay. And how long did that feel for? Like what was it?
I think almost for like 5-6 years.
What?
5-6 years I went through this whole of upheaval of feeling up and down and didn't know and what and how and then after 6 years I got pregnant with my second one. That's where actually my entire journey of healing, learning, all of that started, and I was like, oh.
Yeah, that was a long time.
What did I do? Why was nobody telling me what I'm
Correct.
going through?
Correct.
You know, and that's where I realized that it's not so difficult to come out of it either. With the right support and education, knowing what I need to do,
Yeah.
I could have felt so much better.
Yeah. Yeah.
The whole stress of I have to do everything, not able to cope with it physically, emotionally, mentally, and then Nilesh is doing the best he can, but he also does not know about this.
Yeah. Yeah.
So what do even I tell him, or what will he tell me?
Yeah.
And then going through and not understanding why this sudden friction
Shift.
between us, and why am I not understanding him, and why he's not understanding me, and why this family is giving me such a hard time, and everything was a mess.
Wow, that long.
I so wish I knew about it.
Wow.
Where I could have just...
So as we conclude that educating yourself regarding these, moments and situations that can occur as a part of your pregnancy, post-pregnancy is so important. And I'm sure that if we don't recognize it at the right time, we're really damaging our relationships.
We are.
We are losing out on really good years, moments, months, whatever it may be, for however long it, lasts. Recognizing it is most important. Yes, you may not find the solution immediately, but recognizing that something is feeling off, and then trying to get the right help, which is available with therapists like you.
But I feel,
counselors like you.
Karishma, we don't recognize. Somebody has to tell us.
So this education has to come about in some way. How does one get educated regarding
In the
such
prenatal
things?
classes which we are taking nowadays.
Super.
One
That's
of
where we
the
want to get.
best way to do that is when the doctor or the person is talking to us about pregnancy, about how the child is going to be born, and we're doing yoga and we're doing all of
Correct.
that. How about if she said, after this can happen?
Yes.
And if this happens, one, we are giving you the support because we
Yes.
already have you here. And secondly, these are the things you can do.
Correct.
That
And
could be, and then there is the mother who's gone through it,
Yeah.
who can talk to us.
Yeah.
There's a mother-in-law who's gone through it and can talk to us.
Correct.
There could be an older sister, there can be a friend.
Yeah.
Anybody who's gone through it can say, listen, I feel you're going through this. How about recognizing certain things, go to an expert, streamline it,
Yeah.
find a path and get back on track.
Yeah, so important.
So important.
So important to do that, and obviously be there as women for women. More importantly, that I completely agree with. Coming back to yes, there are these challenges getting back into a full-fledged physical relationship with your partner at that moment of time, and to rekindle that intimacy with now having a third person in your life and making time for intimacy. Now that can be quite the challenge, but just a couple of suggestions as to how you can rework this scenario, because now it's a completely new scenario. Rework it and start literally compartmentalizing time for each other. And I know it can be a very big challenge to do this, and but I think there should be some moments of spontaneity, where you can steal away certain time away from your baby to be intimate with your partner. But what would you think that would definitely add a little more spice coming back from a baby?
First, to know why you don't want it.
Yeah.
If you know why you don't want it, then you can work towards how you can get it.
Correct.
But to what I've known, Karishma, after the baby, it's the best excuse to say, enough.
Oh.
I don't want it anymore because
Okay.
it's so bad. I can give you 10 things to do.
Yeah.
But when you don't want to do it,
Correct.
when you don't want it back in your life, you're not going to
Yeah.
do anything.
True.
So if you are not back on the track, there is a reason, and that reason is one of them don't want it. So figure out where it is and where is the problem, who's denying it.
Correct.
So when you know which of the partner is denying it, then there is a healthier way to question what's going on.
Correct.
Is it genuinely your physical health?
Yes.
Is it some other reason?
Yeah.
Or is it something that we are not doing okay with? And if it is this, if the chemistry, if the attraction, if the spark is missing, which always was, but there was a reason to have sex, which was the babies.
Yes.
Now I have those. Now why
Yeah.
should I have sex with you?
Correct.
It's like that.
Yeah.
So when you figure out what was missing and work on that, there'll be no reason and you won't need tips.
Yeah.
You'll figure it out on your own.
True.
It's so intuitive.
True.
Right?
True.
We need all this because those two people are not communicating to each other what is okay and what is not okay. That's the first thing. People who have the spark.
Yeah.
They can't wait to touch each other. They
Sure.
can't wait to touch each other.
Yeah.
Even when she is feeding the baby
Yeah.
or the father is cleaning the poop,
Yeah.
still there is a spank and still there is a...
musty.
Yes.
Flirtatious. Yeah.
So when the relationship is healthy,
Yes.
you won't need the tips.
Correct. Absolutely. I agree.
But having said this, which is a natural way of looking at it, if you feel tired,
Yeah.
look for how you can feel a little better.
Yeah.
Less tired. Have some help who can do some part of your job.
Correct.
So I used to be the mother who wouldn't give the child to be raised by somebody.
Huh.
Okay, I have to raise my child. But you can wash the clothes, you can prepare the food,
Yeah.
you can go for
Helping hand.
you can play with
Yeah.
them, let
Yeah.
me sleep for a while. All that I could give.
Yes.
All right, but a lot of us don't do that.
Yeah.
Everything
Think
I
we
will
don't-
do.
yeah.
So don't do that to yourself.
Yeah.
When you are tired, not only you are tired, the relationship takes a hit.
True.
And this is not just because I'm tired with the baby. There could be a father who's worked the whole day, come back home, had that 50% of his responsibilities,
Yes.
done that job, and now doesn't want to get physical.
Correct.
He is tired.
Yes.
So I think it's very important, all that you are earning towards, put some into having some help.
Yeah.
No office is run without the staff it
Absolutely.
needs.
Yeah.
Why should your house run without the staff it needs?
Agreed.
So I'm a big believer. So give that extra stuff so that you can be relaxed, happy.
Yeah.
So do that
And make time for it.
and make time for each other.
Yeah.
And then figure out where the real issue is.
True.
But again, go back to all those sexiness, what we were talking about, wear the sexy clothes and flirt a
Yeah.
little, do some masti,
Yeah.
go out for dates,
Yeah.
bring back all that was there just before the baby, which you enjoyed.
Yes.
There's no reason why that should not come back, which you
Correct.
already used to like.
Yes.
So it's a no-brainer.
True.
You don't have to rework on anything.
Yeah.
Copy paste. Begin there
Of
because
course.
there's a lot more that's going to come.
Correct.
So-
I agree. Coming to introducing sexy clothes and dressing up and being sexy again, do you encourage the couples who come to you to include sex toys as a part of their intimacy, whether it be during the pregnancy or post?
Absolutely, absolutely. So there used to be a time where the narrative was use the sex toy because you don't need anybody else. But that's not how
That's
I
not
believe
works.
it.
Yeah, yeah.
I say use sex toys for its own purpose.
Yes.
Add the spark, add some different, spice to it.
Yeah.
It's brilliant to watch your partner work on himself or herself.
Absolutely.
It's a pleasure to see, how their face expressions are, how their body moves.
Yes.
When you're together, you're so close.
Yeah.
You are busy feeling what you are feeling, and you don't even know what's going on with the
Yeah,
partner.
yeah.
So something like this could be so intimate and
Yeah.
so beautiful.
Yeah.
So if you've not done that before, do that.
Yeah.
See, when we are talking only about sex toys, there are so many different things into
Different
it.
kinds,
So it's not just
absolutely.
one thing that we are
No,
talking
no,
about.
not at
so
all.
if it has to bring in a little kink and a little bit of a different flavor
Yes,
to the regular
yes,
boring
yes,
sex, it does
absolutely.
become boring after a while.
Yes.
So bring all these elements.
Yeah.
We call it toys now. Like
Yeah.
earlier, people used to use home items.
Home items.
तो
दुपट्टा लेके भाग लो.
तो कुछ नया नहीं हो रहा है. It's just that we have good quality stuff now rather than putting vegetables and
we have it,
handles and
we have
rods.
it defined कि ये इसी के लिए है, body safe है.
Exactly.
It is meant for this.
It's meant for this.
Yeah.
And
yeah.
the earlier lubes were all those experiments. Now there are
Yes.
safer lubes
Absolutely.
and lubes are so important.
Yes.
While we are talking about all the products,
Yeah.
So absolutely, there are different reasons why I recommend my clients to use the toys. They could
Yes.
be from a dysfunction to spice to experimenting, exploring.
Yeah.
It could be so many different reasons,
Yes.
So definitely.
Yeah, for sure. Spice it up with your
For
lovely, lovely massagers and whatever you find actually.
But if you actually go to understand the first origin of these toys which came, it was to help the women feel the orgasm,
Correct.
to treat the vaginismus.
Yes.
These were made for that.
That's exactly what Sassiest is doing. So, yes.
It was made for
Yeah,
that.
yeah.
So why
That
wouldn't
is
you?
that is absolutely and why wouldn't you know that वो होता है एक होता है ना where a lot of men find vibrators or dildos to be a threat to their masculinity.
Yes.
Where they feel that नहीं अगर इसकी आदत पड़ जाएगी तो मेरी ज़रूरत क्या है? And that's not the case. You have to understand that these are enhancers. These are not replacements.
Yes.
And that is something that we keep harping on, as a part of our content, on social media. That Baba, it's okay. Yes, solo play. Of course, why not? You have the ability to choose when you want pleasure, and that's great. That's very powerful. That's very empowering.
Yeah.
But more importantly, if you have a partner to have fun with, it's double the fun. It's double the excitement.
And it is okay to choose the product you want.
Yes.
You don't have to go for what the whole social media is talking about. So if you're feeling threatened with the length and the girth, don't go for that product.
Correct.
There are so many different variations to that. So go with something that you're okay with.
Yeah, you have a clitoral stimulator, which is
so many different things are available.
So many things. Yeah, absolutely. I completely agree. This is good. This is good. So we have an interesting segment called Sass or Sus. Okay, where we ask you a bunch of questions and you either say Sass, which is obviously the positive or yes, or Sus, which is no, not really. Okay, and you have to have these in your hand, and I'm going to kind of rapid fire you. So let's start. Okay. Embracing post-kids body changes is easy.
Embracing it.
Embracing it. Easy?
Absolutely.
Okay. Prioritizing intimacy amidst exhaustion is unrealistic. Mother's guilt is inevitable?
Yes, but still it can be kind of like maneuvered.
So like in between.
Yeah. So yes, it is true. It's a fact. It does happen. I felt very guilty. I think every mother, some level of guilt is always there.
Correct.
But it is not you don't have to stay there.
True.
You're not stuck there.
True.
So with the right help, you can definitely then it can turn
Super.
around to.
Nice. Exploring intimacy post kids requires immediate adjustment.
No,
No.
not necessarily. As we spoke, I
Yeah.
mean,
Changes in sex life post kids are irreversible.
no.
No. They can be.
They
coming.
can be. Absolutely,
Okay.
absolutely.
Yeah. Feeling sexy again post kids is a lost cause.
Oh, please. It never went away.
Of course, never did. Using massagers and toys is unnecessary post kids. You can.
You can,
and you
absolutely
should
you
introduce
can.
it. No problem. Communicating sexual needs post kids is awkward.
No.
No. If you've had, I think.
I think it also depends on the relationship you've had before
Correct.
the child. So if you
Yeah.
were always talking,
Correct.
but if you're never talking, then it was never.
Correct.
So-
True. Changes in the vagina post kids are permanent.
Changes in the vagina post kids are permanent. No, I will say to begin with. So as we also age,
Yeah.
the elasticity, it does change a
Yes.
little bit, but
Yes.
that little is so little
That
that
it's
there is
not noticeable
not
as
noticeable. Like it is as good as where it was. This is immediately after
Yes.
delivery that I'm talking about.
Yes.
But yes, if you've had like 4 children, 7 children, 16 children, then yes.
Yeah, it's going to change.
It's gonna
of
change.
course. Prioritizing self-care as a parent is selfish.
No, it's a must.
Yes, absolutely.
It's a must.
Absolutely. And that's pretty much it. Yay!
Do.
This was good. Thank you, Niyatii. This has been
My
yet
pleasure.
again another fantastic episode. And I cannot wait to have many more with you, because these are the kind of conversations that I want to really have and continue to have with Sass It Up with Sassiest. Thank you
Same
so
here,
much.
same
Thank
here.
you. Thank you. Thank you.
Thank you once again. Thank you
Thank
once again.
you. Mwah.